Hello, we're back again, and now we're going to continue doing a review of medications for the eye, ophthalmic drugs, and we're going to do a special emphasis on glaucoma drugs. So here we go. So just real quick, glaucoma is known to produce blindness on patients. Uh, what happens on glaucoma is an accumulation of fluid inside the eye, and this accumulation of fluid starts increasing the pressure inside the eye, and this pressure starts affecting the retina, damaging it, and eventually this damage becomes irreversible and the patient goes blind. So we have two types of glaucoma. We have the primary open angle glaucoma. This is the most common glaucoma that we have here in the States. And like I was telling you, it's accumulation of fluid inside the eye, is progressive, and keyword painless. So the patient doesn't rush to see the doctor. Basically, they start to adapt to that loss of vision. And by the time they want to seek medical attention, there's too much damage to the ophthalmic nerve that the ophthalmic doctor cannot do much and patient goes blind. So regarding glaucoma, uh, we have elevation of intraocular pressure, IOP. Usually this type of patient, they have a history of glaucoma in their family. Usually happens advanced age. We see a lot in seniors. And regarding ethnicity background, African and South America ethnicity is more common. So the treatment is chronic. The treatment is topical. And that's where they're going to be asking you questions. How do you apply an eye drop? The technique. So regarding glaucoma, we have two lines of drugs that we provide. We have beta blockers, we have alpha 2 agonists, prostaglandin analogs. On the second line, we have the cholinergic agonists, carbonic anhydrase inhibitors, beta blockers, alpha 2 agonists again, and prostaglandin analogs. So we'll go by one by one on the drugs. Before we do that, we're gonna see the angle closure glaucoma. So the other one was open angle. This is a close angle or narrow angle glaucoma. So here we have a displacement of the iris. The iris moves and blocks the canal where the liquid from the eye, the aqueous humor, uh, goes out. So this happens all of a sudden. So we have an increase in intraocular pressure, and this one is very, very painful. Unfortunately, once this happens, there's not much treatment for it. Patient is gonna go blind within 1 to 2 days. Um, they try to do surgery. Other than that, regarding medications for angle closure glaucoma, topical medications are not that common because the main thing is the surgery. Okay, so basically, we've already seen most of the drugs here. So it's gonna be just a review of what you already know. So beta blockers, they end in LOL. So we have betoxolol, cartilol, levobutanol, metipranolol, and timolol. For the NCLEX and Hazy, they like to use timolol a lot regarding questions of glaucoma. What they do, beta blockers, they reduce the production of the fluid inside the eye. They reduce the production of aqueous humor and prolong the consequences of open angle glaucoma effects. Regarding adverse effects, they're eye drops, so it will be very, very minimal. Maybe irritation of the eye because of the drops. So just a little trick that they may ask you is, how do you prevent the stink from the eye drop to happen in the patient? And it's very simple. You just put the eyedropper bottle inside the fridge, and that's it. So that helps prevent the stink in the eye when you put the eye drops. Other than that, regarding questions, they can go to the extreme, saying that you put the beta blocker on the eye and it was absorbed into the body, and now what is going to happen to the heart? What's going to happen to the lungs? What's going to happen to the liver regarding glucose? And we already went to that. So regarding beta blockers, they're going to block the heart. So that means the patient is going to have a bradycardia, it's going to have an AV block, and it's going to have hypotension. Regarding the lungs, they're going to have bronchoconstriction. So if the patient has a history of asthma, it's going to get exacerbated, or history of COPD. Regarding the liver, glucose control, they're going to go to hypoglycemia. So usually they like to mix beta blockers and glaucoma to ask systemic effects of the beta blocker. Trying to confuse you because you're saying, well, it's an eye drop. What adverse effects you want me to say? Well, yes, it's a fictional world where what happens if you put eye drops and they get absorbed, and what's happened to the body. Prostaglandin analogs, we have latanoprost, travoprost, bimatoprost, tafluprost. So if you notice, they end in prost. And prost, that's the first letters for prostaglandin. So every time you see prost, it's telling you this is a prostaglandin. So same thing, just like the beta blockers, prostaglandin analogs like latanoprost, they're going to lower the intraocular pressure by letting the fluid of the eye escape, outflow, have a better outflow to the Schink canal. The only thing in the highlight, it kind of produces brown pigmentation of the iris. So if I lose a prostaglandin analog and the patient has blue eyes or green eyes, the chronic use of latanoprost is brown pigmentation of the iris, and it's irreversible. Now, if they ask you what happens if the prostaglandin analog gets absorbed into the body, and we'll hear the biggest contraindication is if the patient is pregnant. We mentioned the prostaglandins. They help the stomach make that mucus lining. But if the patient is pregnant, prostaglandins is going to promote labor contraction in the uterus. So as an overall adverse effect, prostaglandins are contraindicated in pregnant patients. Regarding alpha-2 adrenergic agonists, we mentioned this alpha-2 is located in the central nervous system, is inside the brain. And basically what they do, alpha-2 adrenergic agonists, they block beta-1, beta-2, and alpha-1. So same thing, they can ask you clonidine, sorry. The most common medication used is clonidine, and this preparation for the eye, apraclonidine. So like I was telling you, what happens if this medication gets absorbed into the body? What are we gonna see over? Well, if I block beta-1, that's gonna be the heart. Again, bradycardia, AV block, hypotension. Regarding the lungs, bronchoconstriction. Regarding glycemia, we're gonna see hypoglycemia. And again, also because alpha-2, when you stimulate it, it's gonna block alpha-1, beta-1, and beta-2. Pilocarpine, this is a cholinergic agonist. And what we're looking here is for meiosis effect. So I'm gonna constrict the pupil, and the movement of the muscle during that contraction is gonna help push out fluid from the eye, and it's gonna reduce the intraocular pressure. And same thing, they're gonna ask you, okay, what happens if this medication gets absorbed into the body? Well, patients may have diarrhea, uh, uh, they're gonna urinate on themselves, bedwetting, uh, meiosis, well, that's the effect that we want, muscle contraction, we're gonna have bradycardia, we're gonna have bronchoconstriction, we're gonna have emesis, lacrimation, salivation, tears, everything that has to do when I stimulate the parasympathetic nervous system. Now, this is a cholinesterase inhibitor. Again, we already talked about this. This is an enzyme that the function that it has is to break the connection between acetylcholine and the muscarinic receptor. So if I block this enzyme, acetylcholine is going to last longer on the muscarinic receptor, and I'm going to have meiosis in the eye. So the difference between a cholinergic drug like pilocarpine that we just mentioned right here and the cholinesterase inhibitors is that this one has a longer, there you go, has a longer duration of action. Other than that, the adverse effects is the same ones, dumbbells. This is a new group of drugs. We haven't talked about them in this term. Carbonic anhydrase inhibitors. Basically, they're classified as diuretics, so they pull water out of the tissues. The two main ones, acetazolamide over here, and metazolamide, and as you can see, they have the azolamide ending. Azolamide. So they're considered diuretics. They pull water out of the tissues, so they'll be pulling water of the eyeball, and that will decrease the intracranial pressure that we have in glaucoma. Regarding adverse effects, the main one, it says here acid-base disturbances, and again, that's because of the diuretic effect. Usually, it's gonna change the pH of the urine, and also an electrolyte imbalance where I'm gonna use sodium and I'm gonna conserve potassium. Osmotic agents, I told you, every time you see the word osmotic, you need to think water. So we have mannitol, we have urea, we have glycerin, and we have isosorbate that they pull water out of the eyeball. I pull water or fluids out of the eyeball, intracranial pressure is gonna go down. So these are the drugs that are used to treat basically open angle glaucoma. Now we're gonna jump to medications that they are used for evaluation and diagnosis of the eye. So we call that cycloplegics and mydriatic drugs. And again, what they do, they dilate the pupil right here. So because they do that, they are used to evaluate the eye regarding refraction of the eye, intraocular examination, when I want to see that retina all the way in the back, when I'm going to do surgery, and for inflammation of the anterior uvea. Again, the most common use, intraocular examination. The adverse effects, again, we have mydriasis. The pupil is wide open. I cannot concentrate on focusing on one thing close to the eye. So I'm gonna have blurred vision, and I'm gonna have photophobia. Again, the pupil is wide open, so a lot of light is coming in. So basically what they're gonna be asking you is, how do you prevent all this? What is the teaching that you have to do with the patient? And again, very easy. Patient has to go see a doctor. They're going to evaluate the pupil. They're going to they're going to evaluate the eye. They're going to dilate the pupil. So make sure that they have sunglasses with them, preferably the one that they also cover the sides, not just the front, also the sides, and have someone to drive them back home. That's usually the most common question that you're gonna have with a cycloplegic and mydriatics. So what medications we have here? We have phenylephrine. We already talked about phenylephrine. It's an adrenergic agonist. That means that it's gonna stimulate the sympathetic nervous system, very similar to adrenaline. And the reaction of the eye when you stimulate the sympathetic nervous system is to dilate, is to open up. So this is the most common drug that is used. And then to finish this chapter, allergic conjunctivitis. Again, inflammation of the conjunctiva because of dust or something that the patient may be allergic. What they're gonna complain, patients, is itching, burning, a lot of tearing, a lot of tears. Usually, what we use is H1 receptor antagonist. That's the most common drug. So, medications like Benadryl, Claritin, Zyrtec, all those for allergies is the same ones, but on a topical presentation, or it can be via PO, by mouth. So the highlight here is those medications are H1 receptor antagonists. Don't confuse with H2 receptor antagonists. H2 receptor antagonists, we mentioned already that those are medications that are used to block histamine in the stomach and reduce the amount of gastric acid. Other drugs that can be used, NSAIDs to reduce the inflammation of the allergy, glucocorticoids with steroids, short term, usually 3 to 5 day tops, or other ocular decongestants. Other decongestants usually are alpha-1 agonists. So when I use an alpha-1 agonist, it's gonna constrict my blood vessels and it's gonna take the inflammation away. Okay, so that's it for this chapter. Thank you very much for your attention, and I'll be seeing you in the next one.